The digital delivery of healthcare services and the digitization of healthcare records has long been a dream in this country. It remained an elusive one for a long time. Has the COVID-19 pandemic changed the trajectory of that at all? Francois Gratton is Executive Vice President and Group President at Telus Health and the Chair of Telus Health. Thank you very much for being with us, Francois. And I guess I wanted to start with how Telus Health has done differently, or how it's been affected by the this great lockdown, by the COVID-19 pandemic.
Well, as all of us, we back on March 12th or so thereabout, we were all sent home, right? So same thing for the healthcare system. Starting on that day or near the end of March, you saw a massive influx of patients going to the emergency rooms to take care of COVID-19. But at the same time, you saw all the other patients, right? People with regular health issues that still had to take care of their health. And so at Telus Health and others as well, that was an opportunity to really start helping Canada in a major way. We had introduced in the past virtual healthcare solutions. We were ready for the influx of patients, and that's what we did on near the end of March. We saw an exploding demand, I would say, for our services. So basically, if I can, we have three types of service at Telus. The first one is a direct-to-consumer, free of charge service where people can get reimbursed afterwards by the provincial authorities. That was launched in British Columbia, and as soon as the COVID-19 broke out, we launched it in Ontario, Alberta, and Saskatchewan, and it's coming across the country. And within minutes, you can now have access to a virtual care consultation with a doctor. We've got a direct to businesses offering as well, where you can offer a package as part of your health benefits to your employees. And there again, we saw exploding demands, about threefold since the start of the crisis, where people now, employees, can have access to a virtual health consultation within minutes. Or seconds in the case of that platform.
Francois, sorry, go ahead. The third is what?
The third one is a platform aimed towards the physician themselves. So they have practice that had to keep going. And we have a virtual healthcare module integrated into the electronic medical records.
Well, and it's actually on the medical record side, the privacy. There have been impediments to e-health in this country and elsewhere for a long time. The technology is way ahead of people's willingness to use it, I guess is one way to put it, including kind of the incumbent players. Do you see that changing? And I wondered actually whether the pandemic, in some ways you could see it speeding it up, making people more willing to do things electronically that we haven't done before. And on the other hand, I could see it slowing it right down as the health system's attention is just diverted elsewhere. Has it slowed your progress in some ways or helped it?
I would say so. A couple of points there. I think you're absolutely right. Adoption was slow over the years. Privacy was a concern. But when you have privacy and security by design within your solutions like we do, I think it's a lot more secure to act in a digital way where footprints can be left, as opposed to have something on paper on the side of your desk. That would be the first comment there. And there, I think we're thought leaders at Telus in terms of privacy by design. Secondly, part of the issue with the slow rollout is that prior to COVID, provincial authorities did not reimburse doctors for virtual care consultations. As soon as the crisis or the pandemic broke out, within days or weeks, depending on the province, they introduced billing codes now for doctors to get reimbursed. And that really opened the floodgates in terms of the activity going up. I think they're seeing that it's bringing a lot of efficiency in the system, in the healthcare system. If you think about the influx of patients, COVID patients to the emergency wards, you needed to take care of those patients first and foremost. Bringing the rest of the patients now to do virtual consults can act as a triage mechanism, so that only the most urgent matters will actually end up at the hospital. And it also keeps everybody safe. It keeps the patients safe by staying at home, and it keeps the healthcare workers safe along the way too. So I think everybody now are realizing that those are the benefits that are being brought forward by virtual care. So I really think virtual care is here to stay. And, I think this crisis, one of the good outcomes of it will be that we're changing the healthcare system in Canada for good. I think finally the adoption is where we need it to be, and it'll keep growing, I think, in the coming months and years.
It's interesting. Telus Health is one of the parts of Telus, the company that many people know is the mobile player, the wireless player, that's seen as potential high catalyst for growth, but that hasn't been there yet. It hasn't been a major source of revenue and profit for the bigger company. Is there some vision where that does happen? In other words, where you become a bigger piece of that? I'm curious about where you fit inside the Telus world, if you will.
Well. So a couple of points there making me smile, because I do think we're a lot bigger than people realize. We are today the leading healthcare IT player in Canada, bar none. We have a reach to 28,000 physicians through our electronic medical records. 6,500 pharmacies use our pharmacy management system. In terms of health benefit management, we cover 13 million lives across the country. We have healthcare clinics through Medicis and Copeman across the country now, and we do about 84,000 consultations a year. And I could go on and on in terms of statistics. Suffice it to say that right now, if you count our healthcare IT and the infrastructure that supports it, we're about $800 million in revenues within Telus. So it's not the biggest piece of Telus, but it's a big piece, I would say. It's certainly the leader in healthcare IT in Canada. And also, when you looked at 2019, we had double-digit growth in terms of EBITDA growth. And I've got my eyes set on the same type of growth in the future. So I think we are a big piece. I think we are a very strategic piece in terms of realizing our social mission at Telus. And you're going to hear a lot more about us in the future.
All right, and I do want to ask whether your world changes at all with the advent of 5G technology. Does that change or advance the ability to offer product?
I'd say that's the secret piece, the secret recipe of healthcare within Telus. If you look at our healthcare IT solutions and the exchange of information that they do facilitate, you can only do that if you can rely on excellent infrastructure, namely, wireline and wireless networks. And I think in that regard, Telus is not only a Canadian leader, but actually recognized now as a global leader by Ookla, PCMag, OpenSignal. And so when you look at what 5G is going to bring to healthcare and the ability for low latency applications and applications that can rely on the speed and reliability of 5G, you're going to see things like remote diagnostics, but also surgeries that will be able to be done now at a distance. You can think about the impact of healthcare and 5G brought together for rural Canada, and how we're going to be able to take care of health for all Canadians in the future. So yes, 5G will play a big part, and we're very, very excited about it too.
All right, it's good to have you with us, Francois. We appreciate your time today.